After 3 rounds of IVF, I finally again was pregnant. We were super excited, but also a little hesitant. I had had 4 miscarriages, so I just didn't want anything else to go wrong. Unfortunately, I started to feel changes in the lump in my breast, and it started to feel like a burning or stinging sensation. A few days after that, I was diagnosed with invasive ductal carcinoma. I was officially pregnant with cancer.
That was Christine, diagnosed with cancer while pregnant. Joining us now via Zoom to help explain how cancer affects pregnancy is my friend, board-certified OB/GYN, Dr. Nita Landry, and board-certified oncologist, Dr. Grace Suh. So, Dr. Nita, Dr. Suh, welcome to the show. Dr. Suh is an oncologist. What are your major concerns when you find out that a patient is pregnant?
Some of the factors that we take into consideration are the subset of the breast cancer, the extent of cancer at diagnosis or stage, the general health of the patient and the baby, as well as the gestational age at the time of diagnosis.
For sure. And Dr. Nita, how is chemo okay while you're pregnant?
Well, in general, ultimately we want to protect mom and we want to protect baby. So pregnant women with breast cancer are generally treated according to the same guidelines as non-pregnant women, because delaying treatment for 3 to 6 months can actually decrease the long-term value of the chemotherapy. So in an effort to protect the fetus, not all types of chemo are typically used during pregnancy. And if a doctor does think that a mom will need radiation in addition to her chemotherapy, the doctor will make sure that the patient truly understands the benefits as well as the potential risk to the fetus, because we will typically avoid radiation treatment during pregnancy. And another thing that we will typically do is, if we can, we'll stop the chemotherapy about 3 or 4 weeks before delivery to try to prevent some of those, delivery related complications. But it's all about talking to the patient, understanding the risks and benefits, and having a strong team behind you.
Dr. Suh, what are the factors that determine if a cancer patient can carry their baby to term?
It's important to consider the general health of the mother prior to diagnosis of her breast cancer. So, for example, if a patient has underlying conditions such as heart, lung, or kidney problems that were diagnosed prior to the breast cancer diagnosis, definitely that can play a role in her treatment planning. In addition, at a late stage, the cancer itself can disrupt body function. And so we have to take that into consideration as an important factor in our treatment plan.
All right, Dr. Nita, this is an interesting point and question that I need to ask you. Is having IVF treatments with the known increase in hormones for a woman, does this play any part in developing breast cancer?
Dr. Warden, we've been doing IVF for decades now, and many experts and fertility specialists agree that if a woman has an average risk of breast cancer, then IVF treatments will not increase her risk of developing breast cancer in the future. When it comes to BRCA1 and 2 mutations specifically, I've seen research that have differing results. So personally, I would like to see more studies that follow these women over a longer period of time. However, with that being said, I'm not saying that it's a no for these individuals. I just think it's important to sit down with your fertility specialist and talk about the latest research so that you can weigh the risk and benefits for yourself and make the best choice.
Great advice. All right, Christine, biggest questions. How are you and baby Vivian doing today?
I'm doing well. I'm currently getting radiation treatment. I only have about 6 to go. And baby Viv is doing great. She was a little sleepy.
Oh, look at her.
Now. So she's here. She's doing well.
Hi, Viv, you're on TV now.
Hi. She's a little over 5 months. I think she's about 11 pounds, but she's happy and healthy and doing wonderful.
So glad to hear. Thank you for your story. Thank you for your stamina.
Yeah, thank you. Thanks for having me.
Our pleasure. And docs, Dr. Nita and Dr. Suh, thank you for joining us today.